Good afternoon, Scurry County. It's earlier than usual. Usually it's 4 o'clock, but we're going to do this at 2 o'clock today. Um, this is your briefing. I've got Olivia Aparicio with Scurry County Library and Jason Tyler with Scurry County EMS, and they're going to talk about their respective departments and some things that are going on with them as we go forward. I'm going to give you your numbers first. In Texas, there's been 351,775 tests. There's 1,778 in the Texas hospitals. And quit calling Jason, leave him alone for a minute. 29,229 cases reported in Texas, 816 fatalities in Texas, 14,122 patients have recovered, and 210 counties are reporting. In Scurry County, and I'm going to give you one number, the Cogdill numbers, and then I'm going to add on the other numbers that were tested Wednesday. And through Cogdill, there's been 201 tested, and then there was 13 that were tested, so it's a total of 214. Pending through Cogdill is 23, plus those 13 are still pending, so there's been a total of 36 pending cases here in Scurry County. We have a total of 176 negative cases. There have been 2 positive cases, and we have 0 fatalities. And like we explained with those positives, those will always show to be positive cases. We can't ever say that we have 0 positives because we have had those 2 positive cases. So with that, I'm going to turn to Olivia and let her kind of talk about what's going on over at the library now that we're opening it up. And we're opening up at 50% capacity or 25 capacity?
I think we said 25.
25. Okay. All right.
And we did open this morning. Our temporary hours are Monday through Friday, 10 to 5. We are setting an hour aside, the 9 to 10, for patrons 65 and older and for those that have a compromised immune system. The services that we're offering at this time are checkouts, books, audios, DVDs, and we are still offering curbside service to those that don't feel comfortable coming in just yet.
Sure.
I did want to mention the quarantine because I've seen people ask and question how we are going to quarantine and sanitize books and items that come back. We will be placing items in bins, in boxes, and they will be quarantined for 72 hours. And once that's over, they'll go back to the shelves.
Okay. All right. So I went over there this morning to bring you some hand sanitizer, and Amy was spraying the DVDs with a cleaner. And that's, I guess, just to make sure that after somebody goes through, yes, that it's been sanitized.
Yes, we are keeping an eye on when people are browsing, what sections they go to. That way, once they leave, we can spray them down. We spray it down with Lysol, or we have an alcohol solution that we spray.
Okay, all right. And you've done something different with the seating that's in there.
Yes, we have, right at this time, computers are not, we're not going to lease those out,
Sure,
maybe in 2 weeks, depending on how everything goes. So we've removed all the chairs from there. In the big area, we have removed all chairs but one at each table, and each table has 6 feet distance between them. And so, and if you notice too, if you go in there into the library, that there's tape on the floor for the 6 feet distance, and then by the counter as well.
Okay. And we've got G&G Glass that are putting some plexiglass up for the protection of the patrons and the employees there too.
Yes.
And that should be up in the next few days or so.
Mm-hmm.
So, anything else that we need to be aware of?
No, that's we've had a good turnout so far today. People with masks and without masks, and staff are wearing masks.
Okay.
And that's going to be something that we practice.
Okay, very good.
All right.
Thank you.
Thank you.
What's going on, Jason?
Well, lots of things actually. I want to make it clear that the ambulance service, the ER, we're safe, and we want to make y'all feel safe. There's a study that's coming out that the public is not calling the ambulance service until it's way too late, because they may be scared that they could contract it or contract COVID, or that they may be exposed to somebody else who has it. And so there's a fear out there that they could contract it if they go to the hospital or if they go to or if they call an ambulance.
Sure.
And so I just want to reiterate to everybody that we're all safe. We're wearing masks and goggles for your protection and ours. The ER is safe. They're doing the same thing. So please, if you feel sick, you don't feel well, you feel chest pain, you're having respiratory distress, or your loved one is, please call the ambulance, or please seek medical attention, because we would rather you request us and have us come over and check you out. And if we don't transport you, there's no charge for that. That's a public service to the community. And, we'll be wearing a mask and stuff, but again, that's for your safety and ours. And there's nobody in the ambulance service at this time that has any infection, or has been exposed to all the exposures. Time windows are gone. So
Right.
we feel like we're pretty safe. And we just don't want people to delay. If they need help, please call for help.
Sure.
The other part of it is Scurry County EMS is a public service model. And so we want everybody to know that if you need help at your house, or your family members traditionally would help you, we're available. Come to or call the office. We'll come help you. If you have an elderly couple that can't get into the house for some reason and they need assistance, call us. We'll help you do that. We also had providing assistance for video telemedicine. Like if you have a doctor and he wants to do a telemedicine or virtual doctor's visit, then we can help with that and help coordinate that. We can also have some visits at the office, just like we've done in the past with maybe allergy shots or blood pressures and stuff like that. You just may not feel comfortable going to the doctor, but at the same time, we want to make sure that you feel safe and that you're well taken care of. Another thing that I want to touch on is a safety model that just came out from the health department. And DSHS is warning the public of improper use of hand sanitizer,
Right.
and disinfectants. And so any accidental ingestions, sanitizer may be harmful to the skin or eyes, if you may rub your eyes after using it. So try to watch that. Also watch the hand sanitizer bottles around children. The hand sanitizer sometimes smell good, or they're in a colorful bottle. And so we're asking that you keep those out of reach of the children, because they can ingest it and then have alcohol poisoning or other issues. That goes along with your bleach and any other chemicals that you're mixing. Make sure they're all out of the reach of children and that you're using those properly. Making sure you're washing your hands for at least, 20 seconds is a whole lot better than actually using the hand sanitizer. So you don't have hot water, soap, then use the hand sanitizer, but keep it out of the reach of children and stuff like that. Again, avoid mixing the chemicals. You never mix bleach with anything.
Right.
And just use the hand sanitizer when you really don't have the ability to wash your hands. So just watch those. We're using hand sanitizers all over the place. Just make sure that they're out of the reach of children who can, especially 5 and under, that they like to grab things and chew on them, and that could be significantly harmful for their health. So
absolutely.
Just as a reminder. So that's really all I got as a reminder.
Okay.
We're doing the same treatments that we've been doing in the past. We just want to remind everybody that we're still here.
Yeah.
Call us if you need us. It is safe to call us. And if you are sick, please seek medical attention. And if you're just not sure, call us. We'll come check you out and make sure you're doing okay.
That's fantastic. Now, early on, you put in those protocols that this governor's order spells out to people that they have to screen their employees. Y'all were doing that early on, and you're still doing that every day. You're screening all of your employees each shift that comes in, correct?
Yes, each shift comes in, we do a screening. We check off all our employees. We're looking for the same thing that everybody's looking for as healthcare providers: temperature. And of course, the temperature changed, as Kathy said yesterday, to about 100,
right,
with some additional symptoms. And so we've added those symptoms to our screening as well, just like the hospital.
Mm-hmm.
And so we're mirroring a lot of the things that they do, so that we're consistent, and our healthcare system is consistent all the way through. Okay. And so we're screening us. Yes. We're making sure that we're okay. And if we fail those screenings, then we send the employee home.
Sure.
So we're safe in that aspect as well. So,
okay.
Yeah, thanks for bringing that up.
Yeah, absolutely. And that's, I've seen that same study that you're talking about. After we talked about it, I went and looked at it, and there are a lot of people who are afraid of getting COVID from providers. So they're not willing to take that risk, but they're willing to risk the rest of their health. So you have underlying conditions, you need to take care of those conditions as well. And calling EMS is, a lot of times the first step in doing so.
Yeah, a lot of times it is, yeah.
Yeah.
And we're here to help in any way we can, so.
Great. All right. Thank you, Jason.
Thank you.
So I wanted to let you know that from this point on, there's not going to be a weekend update. I feel like we're at a point where we're moving forward. We don't need the everyday briefing. Also, starting next week, it's only going to be Monday, Wednesday, and Friday. If there is some outrageous, severe outbreak or something, I will get on and I will let you know. But I'm not going to do the everyday reporting, so you won't hear from me until Monday afternoon at 4:00. And remember also that it's going to change from the Cogdal doing the reporting to health unit doing the reporting. And the reason for that is because the health unit is getting information from other places just in Cogdal. So all the information goes there and then goes to the hospital. So we're going to reverse that a little bit. The health unit's going to give us the information. Remember that the employee guide that came out with the governor's order is at scurrycovid.com, and I believe it's on the Cogdal website as well. And I think we've linked to it on our Facebook page and websites. So keep that in mind if you're employing people, that you have these guidelines to follow. So with that, thank you, Olivia, and thank you, Jason. Appreciate you both coming today. And I'm going to leave y'all alone. Y'all have a great weekend, and I'll see y'all Monday.